Hey everybody, it's Dr. Jeff Pierce from Michigan Sports and Spine, week 9. Pretty soon we're going to be in double digits. It's going to be exciting. I just honestly, again, want to start. There's just so much craziness in the world, and we're losing perspective of everything. And I'm not on a social platform or anything like that, but it's just, I think a lot of people are taking a toll on a lot of people. I'm trying to keep it simple and light here. I really want to do shouts out to a lot of patients. It's been exciting because patients are talking to me about it. They're asking me questions on the phone that they're like, I don't want you to talk about it on your Facebook Live stuff. But, it's helping me incorporate, getting the questions answered that you're looking for. Because the biggest thing that I want to do is, I learned a long time ago, I may be saying something, I may be answering the question that I think I'm answering, but it's always how you're interpreting what I'm saying. And this is giving me a lot of good feedback to be able to kind of communicate even better than I think I'm a good communicator of what's going on. But the way we've been presenting and the feedback from the patients, both people we know and people we don't know, people that have known me for years, from the early on in my practice to just recently, it's just everything's adding up to be a very positive experience, and I just want to start with, I really appreciate that. And now that I've bored you with that, the questions are picking up to the point that we're having to prioritize. So unfortunately, if we don't get to your questions now, you can email us or hit us on Facebook. I'll be more than happy to answer them if we haven't been able to get to your questions and you're out there. And I apologize up front, but we want to keep it where it's an acceptable time for everyone to be able to get a benefit from our performance here. Anyhow, first question, I've tried going to physical therapy. 2 rounds of 2 weeks of therapy is all my insurance will cover for my lower back pain. It didn't seem to help or provide much relief at all. What's my next step? I've been told I'm not a good candidate for surgery yet. So usually when I lecture my residents or interns or just the fellow physicians, I have a cartoon slide that says, I'm not sure what it is, we'll have to check with your insurance to see what we can do. It's funny, it's satire, but the thing is, it's true. We're being dictated by 2 weeks of therapy is not enough therapy. If you truly have an injury that needs therapy, it's not a 2-week fix. If it's a 2-week fix, then most times you can almost do it on your own. And I'm not saying the therapists are being more efficient, they're doing a lot better job, we're getting things done, we're putting you on home exercises a lot quicker, and that's all beneficial. So I don't want to give the impression that 2 weeks is never enough, but with cases that come to my office, 2 weeks is rarely enough to get you back on the road. So number one, therapy twice, 2 rounds of 2 weeks of therapy. So again, that equals 4 weeks, which should produce some relief if there's just a simple musculoskeletal issue going on. If you're telling me you're not a surgical candidate, that means you have no surgical emergency signs. So with that, I'm not real concerned of, you're going to have, an atrophy of your foot, lost reflexes, things that tell us that we need to worry about surgery a little bit more. You may need to come in and be evaluated by someone, I don't know if you're one of my patients, it doesn't seem like it, but it's, you have to reevaluate who's been treating you. Because like I've said multiple times, not all physical therapists are equal, not all physicians are equal. We've talked about specialists like myself and people in my field. We have special tools to do the evaluations so we can get to the problem quicker. To just say general back pain and go to therapy, that's what I call cookbook medicine, which is never what you get here. Our philosophy is really to home in on what I call the primary pain generator. So the primary pain generator may be the pinched nerve in your back, but you're having a lot of secondary stuff going on. You're having like pain in your buttocks, what people love to say is sciatica, or pain in the hip, or pain in your pelvis, where the tailbone and the spine come together in the pelvis area. That's a very complex region where the nerves come in, there's anatomy coming in, so you can have issues with that. So you truly have to tease out what the true diagnosis is. So to answer your question in a simple way, it doesn't seem to help. I'm not sure you got the right therapy. If it doesn't seem to help, then it's time to see a specialist, a non-surgical specialist, someone that's not going to use surgery or narcotics as the only solution. You need a proper evaluation. And if you're one of my patients, then it's time to come back in and we need to take a step back and reevaluate. I don't know what your MRI findings are, I don't know what your nerve tests were, but in general, if it's not resolving with 4 weeks of therapy, it may be a little bit more concerning where the next steps are. And I usually tell people, my protocols aren't crazy, they're just consistent. So we usually put you on medications, we put you in therapy, we have a very structured home exercise program we ask you to do, we ask you to alter your mechanics throughout the day. That's another big thing. If you're sitting doing the same exact thing every day, if you're working in an environment that irritates your back on a daily basis, a couple hours of therapy a week, 3, maybe 4 hours a week, twice a week, is not going to change anything. You have to adapt and change your environment and your habits. Is probably the best way to resolve things. So I hope that answers your question. It's kind of detailed, but we need, if you haven't been seen, you probably need to come in and see someone, because you definitely need to go to the next level, see a specialist, and go from there. All right. So the next question I'm going to save for the end because it's a little silly. But the third question is how to exercise in this heat. Looking for suggestions because I prefer outdoor activities versus working out indoors. So this is great. I mean, when you're talking about exercise in this heat, I mean, the obvious simple answer is get in a pool. Get in the lake, get in a pool, jump off a boat if you have that luxury. Any type of water sports, because it is going to keep you cool. Even biking. I mean, biking is good. Like everybody who's been listening, I actually got asked this week, how serious of a biker am I? I'm not one of those guys that has the full outfit and the clip-ins and all that. I'm the casual biker that likes to go my 10 to 20 miles and call it a day. But those are things you can start doing that are safe. Kayaking's huge, especially for your upper body core. If you are doing it, I was made fun of by another friend that, take your time kayaking. You got to look around and see, look at the trees, look at the nature. I take that type of kayak, but when I want to work out and I'm actually worried about my core because I have a terrible back, there's a certain way you can, the rowing is a great mid to upper body exercise and incorporating your lower body by the way you move. If you're just kind of stroking the oars side to side and you're kind of cruising around, you're not really going to get a core workout. It's great to do and I encourage you to do it, but if you want to do kayaking or canoeing or paddle boarding, anything like that, there's ways to do it. There's a lot of instruction. I'm not going to stand up and show you right now, but the point is if you're kind of moving in and you're moving your whole body as a core and pulling, one, you get to do it faster, and two, you become more efficient. So it's moving your whole body, not like similar to like a log roll where your whole body's moving. And if this is your pelvis here, you want your whole body moving forward and pulling back. So you engage your core muscles. So you're engaging your abdominal muscles, your rotational muscles. So it's actually a great workout for low back issues. It's not great for people that are in severe pain because it's what we call a stage 3-4 phase of our program. You can't start out if you're in back pain. That's maybe when you want to take the leisure ride. But kayaking is a great sport. In this heat, you throw your water on, you hit the paddle a couple times, you get yourself wet. That's kind of the secrets that I do, that I've stayed cool in this weather over the last couple days, or last couple weeks, I should say. Biking is another big thing, but the problem is when you're moving, if you move at any speed, you're creating some type of breeze on you, so it's better in biking in good positions. People will be like, well, my back hurts more when I bike. You can't have that bad arch. You have to get good posture when you're doing it. And if your back is starting to bother you while you are riding, it's a mental check to say, am I in good posture? Is my pelvis in the right position? Is my back, am I creating that lordotic curve? Am I creating the C-shaped curve? You need to take a look at that and evaluate that a little bit closer if you are seriously biking. So indoors, outdoors. Yeah, I'm with you. I really don't like working out indoors, although I do miss my workouts. I do miss the gym. I mean, you got to work about, full body. How do you make up, for your arms and your chest and things like that. All these type of workouts are great. I mean, it's amazing what you can be resourceful for And to be honest, on Instagram, there's so many workouts, outdoor workouts, doing push-ups off the ground. I saw a guy yesterday, I thought it was so cool. I felt guilty. This guy was in unbelievable shape, but I'm riding by, I'm sweating. This guy's he's on one of those fancy bicycles, and he's doing jump ups. And I would jump to the step, he's jumping to the tabletop. And it was pretty good. That creates a lot of energy, a lot of spring, and obviously that's for the non-injured person. But I'm saying we can be so creative. Like I talked to one of my patients earlier this week. He's like, yeah, I can't get out, I don't have a gym. I go, come on. You could really do a lot of things on your own. There's a lot of core workouts, there's a lot of fitness stuff you can do. Doing pull-ups, old school stuff. You don't need the fancy equipment at every gym, the Planet Fitnesses and stuff like that. There's still many ways to work out and keep yourself body in shape. And then he admitted he's missing the socialness of the workout. So there is a lot of things. So really, to summarize, swimming obviously is huge. And you don't have to be a major swimmer in the pool. You can be pool walking. Especially for my low back patients, it's one of the best treatments for aquatic therapy because of the buoyancy of the water. It takes all that pressure off your spine. And at waist height, you're about 50% of the normal pressures. So when I talk about extra pressure on your hips, knees, and ankles, you're taking about 50% of that off in the pool. So just water walking is a big deal. Swimming's a big deal. And then any type of water sports, the paddle boards, the kayaking, all that stuff. So if that didn't answer your question, let us know. Next question. What would you say is your greatest niche in terms of sports medicine? What are your subspecialties? So, it's the training I've done. For you that may not know, my true profession is physical medicine rehabilitation. That's my main residency. Then I went on and did subspecialty training in sports and spine injuries. So I spent a lot of time with athletes young on. I was trained in Chicago. That's actually where I got into my charity work also with impaired athletes that we worked with out of Rehab Institute of Chicago. I had a huge program. But the subspecialty that I have is in sports medicine. So I'm dealing with all sports medicine. And again, I'm non-surgical. So that means we take care of about 90% of the issues because 90 or 90+% of the issues are non-surgical. They're mostly in the ligaments, muscular structures, and alignments. So we're able to deal with that. And then the spine stuff, I did my further training for invasive procedures. So that's where the epidurals, all the injections. And now with the extra training I've done years later, we're now into the regenerative medicine, the platelet-rich plasma, the stem cell, all that is taking toll. And now we're trying to do the IV therapies too. So I'm always evolving because, like some of you that know me, I get bored and I have to have something going on. So I further my education and what I'm trying to do through that. So subspecialty-wise, the basic term is physical medicine rehabilitation with a subspecialty in sports and spine injuries. And that doesn't mean when I say sports injuries that, that's for only the top-end athletes. And, I love taking care of those guys. I enjoy it. I enjoy taking care of the entertainers. But it's not the majority of my practice. The majority of my practice are what we call the industrial athletes. We coined that about 15 years ago. So when we came out, it was the industrial athlete. And when you think about it, you're going to work every day. That's very, it takes a toll on the body. So a sport takes a toll on the body. But, if you're an assembly worker, if you're changing tires, I got elevator workers, all that, there's shoulder injuries, there's knee injuries, there's hip injuries. It's just a different type of impact, different type of routine that you're doing. So really, everybody that's working is industrial athlete. The Wickham Warriors, that's, another thing. The guys that don't want to give up. Really, it happens in that 28 to 40-year-old age where they have the mentality of their 20s to 25, but they don't have the body to go along with it. So it's the weekend warriors that we deal with also, but also everybody next door. I mean, lifting your kid is an activity that needs to be done. So we came out early on when I was dealing with the Pistons. We came out with the slogan, we treat everyone from professional athletes and those who are far from it. And it was funny because I had a very active older woman who would be roller skating. She was a very active individual. She was like, I think 80 some years old. So, I mean, she was tougher than some of my professional athletes at the time. So it's just a cute way of saying, we're here for everybody. We're not just for the professional athletes. So it's really expanded the practice. So hopefully that answers your question. Next questions. Have you had any patients that were doing really well, then later on started doing worse than they were doing before? I have still done my physical therapy at home and haven't changed medications, but my knees ache, have gone from... So I'm sorry if I paused there. Someone was trying to call in. I'm trying to interrupt my Facebook. Anyhow, so really to summarize, it's basically I got better and then I got worse. I feel like I've been doing the same routine over and over, and I'm not getting, what do I do at this point? Did I do something wrong? So the thing is, that's a hard question without evaluating you. Usually there is some type of change. There is some type of change in your dynamics, in your mechanics of what you're doing. Knees can be tricky. Knees have a wear out point. I believe that with your knees and all your joints, you get so many rotations. So if you're a very high-end athlete, it's better because your core strength is around it, but the joint itself has a wear and tear factor. Just like a bicycle or a car, they can only last so long. The better you take care of it, the better you preserve it, the longer you're going to last. In this case, I'm not sure. I mean, this is almost where you need to reevaluate. I don't know exactly why you'd be getting worse without any type of trauma or injury. A lot of times people will, once they're starting to feel better, they'll start another activity, and that new activity can be detrimental. And the other thing that I worry about, like if they're starting to run or bike or something, their mechanics might be off. So you might be putting different forces on the knee itself in this case. I had a similar case today where it was his low back. He was all better. We saw him in February before the pandemic and everything. We lost him. I thought maybe he was just lost. He was like, no, I was feeling great. What we did, and with that case, we didn't have to go very far. We did medications and therapy, redirected his mechanics, which is another big deal. You have to redirect your mechanics and change his lifestyle, which I said earlier, to really get a true improvement. So with that, he's actually had a relapse because he's like, I really didn't do anything. And I always make fun that you can be, going to the bathroom, reaching for the toilet paper as you twist and sneeze, and it'll blow your back out again. It's that mechanical movement and bad timing that can do it. So it's not always predictable. What is predictable is that if you work harder, and like I have always said, when you're feeling good, that's the best time to work your core. And that's the big message that I gave him today, and he admits that I slacked off. So when you're feeling better, that's not the time to say, oh, forget it, I forgot about it, which is very classic for individuals. But that's the time where you really strengthen up, because it's hard to strengthen muscles when you're in pain. They want to shut down. There's firing patterns that aren't working correctly. You have to restore the mechanics, get your full flexibility, and get your strength. And a lot of times, I mean, this guy's big. He's 240, 6'2", 6'3". He's a big, muscular guy. He's used to just powering through things. It's hard to tell them you got to take a step back and rethink it. So that was really the message for him today. Fortunately, he's starting to feel better. He's back about 70% of what his baseline is. But the big message was like, I don't say, okay, great, goodbye. It's more like I hammered home. It's important for you to remind yourself that you need to continue doing those home exercises to continue to stretch and strengthen those areas, which is the big message for today, is that you've got to resolve things. No matter what the issue is, you need to get full range of motion, continue strengthening and stretching. You need to get full range of motion, strengthen that area, and condition it. And that way, it doesn't prove that you're never going to have another relapse, or you don't freak out when you have a relapse. But if you've done that, your recovery is so much quicker. Getting to last question. Do we do this?
Yeah.
All right, it says, what is the coolest thing you've done being Rock Doc?
Tell us what it is.
So I have 2 minutes to answer this. It's too long of an answer. For those who don't know, I'm the physician for all the entertainers, which is very disappointing because it's exciting for me. It really makes my summers go faster. I cover pretty much all the concerts at Little Caesars, at Pine Knob, at Meadowbrook. Tiger Stadium, Ford Field, really everyone. For those who don't know, I've been doing that since 2000, and it's fun to be backstage, and it's fun to be there with the entertainers and everything. But there's a lot of pressure. I mean, I can't really talk about it, but just being in that environment, seeing these guys, and everybody's like, "Oh, you're starstruck or this or that." I'm like, no, I truly appreciate how hard these guys are working. Like the biggest story I can tell is like with Phil Collins. So this isn't like anything medical. This guy was in unbelievable shape. I mean, he was playing with a soccer ball to warm up. Their endurance. I mean, he had a 20-yard stage, and he was running that whole stage. Or even Mick Jagger. You watch Mick Jagger, this guy is singing and running. If you could have a conversation while riding your bicycle or being on a treadmill, then you can maybe understand how hard it is. I mean, I'm notorious if I'm on my workout, I'm not having a good conversation with anybody. It's hard to have that kind of win. So these entertainers are unbelievable athletes. If you get close to me and you get to talk, I kind of can't really talk about it on air, but I've met every entertainer there is. The only person I really didn't get to meet was Michael Jackson. But I mean, Prince, before he passed away, I have great stories about Prince. Mick Jagger, Def Leppard, like all of them. My close friends here, all the entertainers here, especially Kid Rock. I always do a shout out for Kid Rock. Very close, good friends with that. It's just, I guess the coolest thing is just being able to be in that environment, help them out. I have one story about Pavarotti. He refused to go on. We had to get him feeling better, and he did perform that night at the Palace after about a 45-minute delay. So it's just, it's a 20-year history of stories like that. They say I should write a book, but unfortunately I can't share some of the coolest things. But overall, it's just a great experience being backstage. But I truly appreciate the entertainers for what they do. I think they get short on the amount of work they do, the commitment they do, and their lifestyle. Their lifestyle is cool. Everybody wants to party like a rock star, but there's a toll on your body too. And a lot of the new entertainers, especially the country guys, I love the country guys. Stories about all of them. Tim McGraw was the first one to have a whole workout semi on the road. Now everybody's doing it. I get to make suggestions of adapting out what they need on the road. I've done that with a lot of the entertainers, and we get them rehab throughout the country because of my connections through all the sports medicine docs in the country. So that's been pretty cool. But last weekend was great. It looks like we're gonna get a little rain this week, cool things off. But get out, stay active, keep the questions, and I really appreciate you listening in, and tell all your friends because we want to keep this going. Peace out.